Here once again to give an update on the coronavirus and how it affects us here at St. Anne's. Some things will be reviewed, but a lot has happened since I was here last, and so we'll try to bring some updates regarding some new things. So again, updates and things we've learned since I was here last. Also talking a little bit about what our local situation is surrounding us here in Lancaster County. And again, talking a little bit more about how we can keep doing what we have been doing, keeping St. Anne's free of the coronavirus. I think more than any other time in my practice, I feel like we are learning as we are doing. This is all new, and as we go along, we learn more and we change what we're doing. And so if this seems confusing and what we did last week is not the same as what we're recommending this week, it's because we're literally learning about this disease as we're trying to treat it. Again, remember, COVID is a coronavirus. This is a typical respiratory virus that is related to viruses that we've probably all had at one point. Cold viruses. The new virus, of course, is called SARS-CoV-2. Usually people just say COVID to refer to the disease. Despite maybe some conspiracy theories that you've heard, this virus we think did come from bats. Bats are host to lots of different coronaviruses, and somehow this virus made its way from a bat, probably through another animal, and into humans in China. The end of 2019, and then made its way to this country through people traveling. There's evidence now that it was probably in our country and circulating as early as January. So long before we ever were really concerned about it or thinking much about it, it was already circulating. We just didn't know it, and I'm sure we'll learn more about that as time progresses. So again, generally when the virus attacks, it takes about 5 days from the time that we're exposed to it until we start to get sick from it, or at least until we are able to detect that it's present. Unique to this condition is the wide variety of symptoms that people might have. People may have no symptoms at all. Usually these tend to be younger, healthier people, or they may have very serious symptoms, and this tends to be more our seniors. What we still don't know for sure is whether after you recover from this condition, whether you have some level of immunity. We believe you probably do. That's what happens with other coronaviruses. How long that lasts, those are still a lot of big unknowns. In terms of transmission, this is changing a bit as well. Primarily this gets from person to person through coughs and sneezes, through droplets. And hence the caution to stay 6 feet away. These droplets usually don't stay in the air longer than 6 feet to get from person to person. But there are situations we're finding where the virus is transmitted in an airborne fashion, and that's a little more worrisome. So things like shouting, singing, produce much smaller particles that can stay suspended in the air and float around for longer periods of time, and we call that airborne as opposed to droplet. And that makes it more contagious, and that makes it more concerning. You can also get it by touching surfaces that have had these droplets on them, and you get the virus on your hand, and of course you rub your eyes or your nose, and the virus gets into your body that way. Probably it doesn't last on surfaces real long, a couple of days maybe for surfaces like metal or plastic, 3 days maybe. Paper, probably 1 or less. Copper seems to be a very good antiseptic and probably only lasts a few hours on copper surfaces. So there are companies that are now making copper doorknobs and copper hardware for people to put in their houses for this reason. So mostly this virus gets into us through being inhaled through our nose or through our mouth. It gets into us through us touching our face with viruses on our hands. Something else that we're learning and we don't know all the details about is that it probably is possible to also get this virus through our eyes. And so there's additional guidance now, and actually at the hospital now when we see patients, we wear eye covering. We wear goggles or we wear face shields. So that's something that's new since I talked to you last. We don't know all the details about whether eyes are a significant portal, but it's a precaution that we're taking. In terms of symptoms, these are all things that we would expect in somebody who is symptomatic from COVID-19. High fever, cough, maybe chest pain, shortness of breath. Diarrhea can be a pretty significant symptom for a lot of people. Muscle aches, extreme fatigue. And we're recognizing more and more the importance of the symptom of loss of smell and taste that seems to be unique to this virus as well. And as is often the case with our seniors, symptoms tend to be milder, they tend to be more subtle, they tend to have fewer symptoms. Sometimes it's just that they're different, they change, they're weaker, they stop eating, might be a little more confused. And these are all things that happen to seniors on a day-to-day basis anyway, so it makes it really difficult to recognize in our population, is this just an off day or is there something more serious going on? So it's a challenge. Fever is not always present. Seniors may have more GI symptoms than respiratory symptoms. But again, it is a challenge to recognize it in the senior population. Something else that's new since I talked to you last is a new condition that's showing up in children. This is something that has been called multi-system inflammatory syndrome in children. And this, we believe, is something that happens as a result of the immune system of the children being overactive after they recover from the condition. Remember, usually children are not very much affected by COVID. They usually recover or have few symptoms, but a small percent of them may go on to develop this sort of hyper excited, hyperactivated immune system. And they get inflammation of their heart and other body organs. Some children have died from this. Treatment is mostly supportive. So it's something we're still learning about. It's interesting, it seems like this is just mostly on the East Coast. They're not seeing much of this on the West Coast, and they didn't see it in China. At least they didn't describe it in China. So again, exactly why we're seeing so much of this in the East, we don't know yet. Something that we're recognizing more and more, and I think we alluded to this a little bit last time, but I think it's become more important, is the whole idea of people being carriers and people being spreaders of the condition who don't have any symptoms at all, who are perfectly fine and well. In studies where they looked at a whole population that was maybe confined to a ship or confined to a nursing home, and they tested everybody, what they found was that there was a high percent of people who were tested positive who didn't have any symptoms that we would normally associate with COVID. Some of those people may have been what we call pre-symptomatic. In other words, they were about to have symptoms, but at the time of the testing weren't having, so got them later. But a lot of them, particularly younger, healthier people, never did get symptoms. So this is the challenge with this condition, is that it can be spread in the community from people who are well and feel well. And unlike a lot of diseases that we're used to dealing with, looking for symptoms, screening for symptoms, it just doesn't apply to a lot of people with COVID. So again, the analogy of the iceberg. So on top of the water are a few people who have symptoms, but below the water are a whole lot of people that aren't having any symptoms. And so that is the challenge of this condition. In terms of testing, two basic types. The one that we hear the most about is the Pcr testing. That's the nasal swab, where they swab your nose and back of your throat to pick up some viral material and then test for the RNA of that virus. It's very operator dependent, so if you don't swab long enough, or if you don't stick the swab back far enough, or you don't handle the specimen quite right, you may get a falsely negative test. So that's something we've seen at the hospital a fair amount. People have typical symptoms, but they test negative. And they might test negative 2 times before we get a positive. So there is that problem with the testing. Also depends on where the person is in the disease as to how much virus they're shedding. So they may not be shedding very much virus, and at that point their test may be negative as well. The other kind of test is really a test of the body's response to the virus. That's the antibody test. And unfortunately, that's kind of a work in progress. The FDA gave sort of an open license for a lot of companies to develop these antibody tests to try to encourage lots of these to be produced, and lots were. However, the oversight and the quality control for a lot of these companies has not been great, and so there are a lot of tests out there for antibodies that really aren't very reliable. So sometimes it's a little hard to know what to make of these tests, so you have to be careful about where the test is actually from, how reliable is it, and what we don't even know if it is a reliable test is what does it really mean. So if you have the antibodies, does that mean that you have some level of immunity? Again, we don't know that yet. So this whole issue of testing for antibodies, there's still a lot more to be learned about that, and I actually at this point am not recommending my patients to have the testing done just because we don't know what it means. And we don't know if it's even reliable. So I think it's a little early to be relying on that particular kind of test. For people who want to donate their plasma, who we know have recovered, the test is useful for that as a marker of recovery. But that's the primary way in which we're using it nowadays. Again, this disease is a little bit unique in terms of this wide variety of ways in which it can affect people, from being completely well and asymptomatic all the way up to dying from the condition. We know that one is more likely to have more severe disease with increases in age, chronic health conditions, and for some reason which we don't fully understand yet, it seems that males don't do as well as females do with this condition. In terms of the chronic health problems, these are a list of ones that have been associated with increased severity of disease and death. In terms of treatment, this has changed since I talked to you last. Remdesivir, which is an antiviral drug that was originally developed to treat hepatitis C, and then it was used to treat SARS, and then they even tried it on Ebola. It's been around for a while. It really hasn't found much of a use, but they tried it with COVID, and it does seem to reduce the length of time that people are sick. So they did do a fairly large trial with it, and they found that people who received it, in general, got well or got home about 4 days earlier than those that didn't receive it. So it's kind of like taking Tamiflu for the flu. It's not a cure, but it helps. You get over it quicker. It is something. On the other hand, hydroxychloroquine was felt to perhaps be useful early on, has been shown not to be that useful, and actually, because of problems with cardiac toxicity, people who were studied, more of them died who were on the hydroxychloroquine than were not on the hydroxychloroquine. And so it really is not recommended and not being used at the hospital these days for people who are positive. We are using plasma from people who have recovered from the condition. We call that Convalescent Serum. So people who have had the disease and recovered from it have the antibodies in their blood. That blood is removed. The plasma is separated from the red blood cells, and then that plasma is infused into somebody who is infected. And those antibodies then help fight off the virus. So that has been shown to be helpful. There's a lot of other different antiviral medications that are being studied, as well as medicines that reduce the significant inflammation associated with the disease. So still a lot in progress. I would say nothing that is a cure and nothing that is groundbreaking at this point yet. The issue with the vaccine, that's the long-term hope for this condition. There are lots of them being worked on at the same time by a number of different companies. There have been some early promising results, studies in both people as well as monkeys. It seems to be that some of the viruses, some of the vaccines that have been developed have been able to produce the right kind of antibodies that we would hope that they would produce. And so now we're just waiting on the next level of studies to show that they're safe and show that they're effective. The problem is all this takes time. And so I don't have a lot of hope that this is going to be ready before the end of the year. One thing you may have heard about is so-called herd immunity. So this is the idea that you just let enough people in the population get it and recover from it, and pretty soon enough people have antibodies that the disease isn't around anymore. So that's kind of what they tried in Sweden. They, in Sweden, decided not to close down their society at all. They left the schools open, they left the businesses open. They just said, you know, do the common sense things. They tried to protect the elderly and keep them sheltered away, but everybody else, they just kind of left society open. And it didn't work out very well for Sweden. So Sweden has one of the highest death rates per population from COVID so far. So if you look at this graph, so this is the sort of death rate for over the last 2 months for Sweden. Here we are in the United States, and this is Norway, Sweden's next door neighbor. So they took a different tack. They sort of closed everything down. They very much closed things up, and it made a big difference in terms of the number of deaths that they saw. So, and at the end of the day, unfortunately, the difference in percentage of the population that actually has the antibodies in Sweden is not really that high yet. So they've gone through all this pain and they still don't have herd immunity yet. So it seems that that approach didn't work out very well. So locally here in Lancaster, really this has been a condition that has disproportionately affected the seniors. As you can see, the majority of the deaths in those 70 and up. Again, remember, if we could manufacture a condition that would be the very worst for seniors, this is kind of it. This is a condition that is very hard for seniors. They're more susceptible to it. but yet the people that care for them can bring it in and not be aware of it and not have symptoms. And so you can't socially distance and take care of people in a nursing home. You know, you can't care for someone and keep a 6-foot distance from them. So it just is kind of the perfect setting for a disaster, and that's what has happened here in Lancaster, unfortunately. Not everywhere, certainly not here, but it has been very difficult in a number of facilities. It's estimated that in the United States, more than 40% of all deaths have happened in long-term care facilities. So across the country, it's been a big problem. There have been a number of large outbreaks in facilities at different parts of the country. And it turns out, not what we expected. We were expecting hospitals to be overrun, and they were to some extent in New York City, but most everywhere else, hospitals have not been overrun, but nursing homes have been. In Lancaster at this point, what we see is that there's still widespread community spreads, meaning that you can catch it from people out in the community. It's out there. We know that many facilities in Lancaster have been affected, and to date we've had over 3,000 people test positive and about 300 people die from COVID in Lancaster. And I would say Lancaster, relative to other counties, has been hit pretty hard. If we look more closely at the senior care facilities, at this point, as of last Friday at least, 22 of the 30 skilled care facilities in Lancaster had COVID within their residents or their staff. So it is very prevalent in Lancaster County. 14 personal care facilities have had cases. And of the 292 deaths as of last Friday, 265 of them were long-term care residents. So over 90% of the deaths in Lancaster County are long-term care residents. And probably over 200 healthcare workers in long-term care have also tested positive, but as far as I know, we have not had any deaths. And if we look at what happened to those portions, most of them stayed at the nursing home. So this is a graph looking at different facilities in Lancaster as of 2 weeks ago. The blue bars are the people that stayed at the home and tended to perish there. And the yellow are the ones that were sent to the hospital. So you can see that for many long-term care residents, they stayed at the long-term care resident. Thus, the hospitals have not been overrun, but rather the long-term care facilities have been caring for these residents in their last days in place. So what's happening in Lancaster with the coronaviruses to date? You know, if you look at this sideways, maybe you can say, well, I think we're going down a little bit, but to me it looks pretty much like a flat line. You know, there's a lot of zigzags, but it's just, I don't see that there's a big trend going down. So these are the new cases per day in Lancaster County, and so I'm not sure what that means, but it seems like it means that it's not going away soon. So what we found in skilled care, and there have been a number of studies and a number of reports since I last talked to you, is that a number of facilities have undertaken facility-wide testing where they test all the residents and all the staff. And what they found was in facilities that were felt to be negative, that had no symptoms, no cases that were known, they found asymptomatic people, both in staff and residents. And in those facilities where they knew that they had a few positives, they found a lot more asymptomatic people. And usually, the asymptomatic ones made up more than half of the cases that they found. So what can we do to try to reduce and prevent this from affecting our facility? And it's the things that you know. So the importance of keeping the masks on, the importance of frequently washing hands, disinfecting with alcohol, keeping the distance when possible. Obviously, we know that you can't do that and provide care necessarily. Certainly, it matters where you are. So a long-term care facility in Montana, for example, may not have to worry too much. But a long-term care facility in Lancaster that's surrounded by the numbers that we see, we really need to be vigilant. We really need to be concerned that at any point it could come here. We know that being outdoors is safer than being indoors. So the virus is less likely to spread outdoors than it is indoors. So certainly that issue of airborne virus kind of goes away when there's wind and then there's dilution in the air. Sunshine also is very good to help keep the level of viruses down. So to the extent that we can be outdoors, that reduces our risk. We're learning that masks are really pretty important. And I think, as I look back, I think that's one thing that has been helpful to us here, that we started wearing masks pretty early, I think. I think that has helped to keep our residents safe. As annoying as they are, I think they really do make a difference. If you look at countries in the world where mask wearing is kind of accepted and what they do whenever they get colds, a lot of the Asian countries, they tended to have less of a problem with this disease because the population was used to wearing masks and they wore masks very frequently. What they will do is they reduce the spread in the community from people who are well. And they also reduce the spread in healthcare facilities, hospitals, and nursing homes where the caregivers are providing care. Keeping their mask on decreases the risk of the virus spreading from the caregiver to the resident or patient. So I included this slide, this next slide, so that you can help educate people around you, maybe family members who, maybe that teenager or that ornery uncle who doesn't want to wear a mask. So if you think of wearing masks and the coronavirus as being analogous to urine, if everybody's naked and somebody pees on you, you're going to get wet, okay? But if you're wearing pants and somebody pees on you, you're going to get a little wet, but not as wet. And if both of you have pants on, the person who's peeing isn't going to make you wet at all. So if that's helpful, think of that as an analogy for why we should be wearing our face masks. And please try to encourage people to wear them correctly. I know we all see this as we're out at the grocery store or in the street, wearing under the chin or under the nose, and they're just not very helpful unless they're covering their mouth or nose. It seems that recently there's much less concern about crowds and social distancing. This was the crowd watching the liftoff of the spaceship this past weekend in Florida. So, I have concerns about what that means for the virus in the community, because it seems like people are really getting tired of this and they want to get back to the way things that used to be. And unfortunately, the virus is what the virus is, and it will continue to do what it does, and depending on our actions, will determine the outcome. In terms of what we can do specifically to keep our residents here at St. Anne's safe, again, it's doing what you're doing and being diligent about it. Trying to reduce as much as possible the people that come here that could potentially bring it in, making sure that at all times when we're here that we have masks on, making sure that we're cleaning surfaces frequently, washing hands frequently, not coming to work if you're sick, screening for symptoms, although we know that we're not catching everybody when we just screen for symptoms because maybe people don't have symptoms. Another part of this that is coming, and I don't know when or what the details will be, but at some point we're going to need to start doing universal testing. Universal testing, again, is testing all residents and all staff to see if anybody is positive, and then furloughing or cohorting those people that are positive for a period of time, again, to reduce the risk of asymptomatic spread. It's the only way that we're going to interrupt asymptomatic spread. The problem is that a test is a snapshot in time. It's on that particular day. That was the positive and negative for that day. 2 days later, it could be a different picture. And so that's the difficulty. And I think that in the future, we may be looking at regular testing of our staff, maybe on a weekly basis. So that's not here yet, but that may be the way where things are headed. The problem is it's not pleasant, it's not fun to have someone put a swab in your nose. There may be some better tests in the future that aren't as difficult. It's also expensive. The tests are like $100 a piece, and so how does a facility, cover that kind of expense when you have to test everybody all the time? So these are things that are being worked on and looked at, but there are a number of states surrounding Pennsylvania that have now mandated universal testing, New York and Maryland and New Jersey. So it's, I think, coming. It just hasn't been mandated yet, but it has been recommended. Keeping our staff safe is important. One of the things that other facilities in Lancaster have dealt with is when they have an outbreak, not only do the residents get sick, but the staff gets sick, and then they have staffing issues. And so it's really critical that we keep ourselves healthy as well as we're caring for our residents, that we wear the proper protective gear to protect us, that we're washing hands frequently, and that we're keeping ourselves healthy, that we do the things that we should be doing to maintain our own physical health. Again, different kinds of masks. The masks that we're all wearing here, the surgical masks, are good at preventing spread to other people. The N95 masks are really good at preventing us from getting the disease as well as giving it. So we're limiting the use of the N95 masks because they're pretty scarce at this point to those situations where we know we have people that are positive and we're caring for them. Cloth masks are also pretty good at preventing spread from the individual out into the community, and so you see a lot of that in the community. So one thing that we're hearing more about is, as the state is moving towards reopening, businesses are opening, there's a lot of pressure politically and otherwise to open and undo some of the restrictions that we've been living with. So the question is, at what point do we start to reopen St. Anne's? I think that's probably the last place that we should be reopening at this point because of the risk to our seniors. So I don't think until things are very much different in the community, we should be considering that. We'll need to have a very robust testing kind of program in place before we're ready to open. So we'll need to know that all of our residents and all of our staff are negative before we're ready to do that. We may even need to consider testing visitors before we allow them to come. So these are all things we need to think about and work out. And until we can actually do testing here on site that has a very rapid turnaround, it's just not practical. You can't expect to open a facility and have a 2-day turnaround for testing. It just doesn't, it isn't going to work. And ultimately, I think what it's going to take is, of course, a vaccine that can reduce the risk in the community and to our residents. So I don't see it in the near future, at least at this point. So it seems to me that right now the numbers in the community are kind of steady, maybe very gradually reducing, but not quickly. There is a lot of political pressure, I think, to reopen and reduce restrictions, and I can understand that, you know, particularly for businesses that have been suffering under all those restrictions. But I think for our particular industry, we need to be vigilant and we need to continue doing what we're doing. Whether this is going to continue to improve over the summer or whether it's just going to kind of linger, I don't know. There is a lot of concern about maybe a recurrence or a worsening in the fall. And, you know, again, what happens in the community is going to largely be determined on our behavior. The virus is what the virus is, and it will infect people if they get close together, and it won't infect people if they, you know, do what we know works. So we'll just have to see how it works out. But I just want to say to the staff, thank you so much for the diligent work that you've been doing. You know, St. Anne's is one of few facilities in Lancaster County who hasn't had cases, hasn't had any deaths, hasn't had any positive staff or residents. And so it's because of the diligent work that you're doing. So keep up the good work. It is working.